Today, the percentage of the population older than 65 worldwide is 9%, and it is projected to reach nearly 70% in 2050. The speedy amount of aging population results in more stressed out caregivers looking after their aging parents, spouses, and siblings who enter hospitals for treatment. While many people have discussed ways to improve the patient's hospitalization experience, the caregiver's caregiving experience is often neglected. Thus, we propose that by building a sounder and more connected caring web, family caregivers' stress during caregiving can be relieved. Aiming to find out the stressors incurred upon family caregivers, we conducted observations and interviews. Results indicate that family caregivers undergo 4 major types of daily pressure while providing caregiving for their family members. First, when nurses are delivering caregiving information that should be noted and practiced regularly, caregivers sometimes miss or forget the information. Secondly, they feel like they can't always report symptoms of the patients to doctors precisely. Thirdly, they feel rushed and exhausted during mealtimes and cannot take good care of either the patients or themselves. Lastly, handover of caregiving is not smooth enough because different caregivers do not share same information of the patients. In order to solve the 4 major problems encountered by the caregivers, we designed a system, WeCare, to relieve caregivers' stress. WeCare would be placed at a fixed position in hospital rooms since it's designed to be used by many. In addition, since our targeted caregivers are those who are also part of the aging population, we would utilize a tablet-sized screen that is more appealing to the eyes and easier to use compared to a phone-sized screen. Each of the 4 functions of WeCare corresponds to one of the 4 stressors that are induced when caregivers are interacting with nurses, doctors, patients, and other caregivers. Memorize enables the nurses to both visually and manually show caregivers care information that they should take notice of, such as when to take medicines. With Memorize, information could be delivered and memorized with little effort. Report enables caregivers to immediately record the symptoms or signs of patients that they have observed, which prevents forgetfulness during consultation and improves report precision between caregivers and doctors. Eat will let caregivers order meals in hospital rooms without bustling around in the hospital cafeteria, thereby allowing caregivers to help and interact with patients at leisure. Calendar enables multiple caregivers to review past information and reports by clicking on a specific date. With the help of Calendar, different caregivers can seamlessly exchange information even if they are not always present. Memorize elevates communication efficiency between caregivers and nurses. Report improves information precision between caregivers and doctors. Eat enables caregivers to spend quality time with patients during meal times. And Calendar integrates information for multiple caregivers. With WeCare, family caregivers' stress is relieved and caregiving becomes a more connected social web in the end.